In the meantime, another option for helping people dealing with mental health crisis got a big old boost today. This week, the Portland Streets response is expanding. Just a few minutes ago, they started their very first night shift. Portland Street Response is meant to keep police from going to calls where they're not really needed. It's for people who are not violent and have mental health or addiction issues, or as we often see, both. Most of the calls they get are for wellness checks. Maybe somebody's laying in the sidewalk or it's an unwanted person on a property. They've been working in the Lentz neighborhood since last February, and last month a Portland State University study showed police went to 22% fewer non-emergency calls because Portland Street Response handled those instead. This week, the team expanded to most of Southeast Portland. They went from covering 13 square miles to 36 miles and 22 neighborhoods.
The hope is that, we'll continue to get busier and we'll continue to be able to divert calls away from the emergency departments and really help provide a more appropriate response for people who are in need. Right now, we're just responding to calls that are outside, so we're not yet going into residences. But that's what I hope will be the next step here shortly, is for us to continue to expand not only geography, not only across the city and the shifts, but also in the call types that we can take.
They're not yet operating 24/7. The new night shift will respond to calls from 6 till 2:30 a.m. Thursday through Sunday. The rest of the team is there 7 days a week, just not at night. The citywide launch could come as soon as next March if Portland City Council approves the funding. Again, it's a non-police team. They can only go to calls that are non-violent, no weapons present, no crimes happening. But they have worked with Portland Police on some training. Each crew is made up of 4 people, including an EMT and a mental health specialist. If you live in Southeast Portland and you need the team, you can get them by calling 911. Well, we get a lot of questions, concerns, and ideas for solving problems involving mental health and homelessness and the housing crisis. And for goodness sakes, each one of those is a huge issue on its own, and we want to stay on top of them. And we're smarter because you are telling us what you're worried about, what you're frustrated about. So please keep your comments and ideas coming. You can send them via email. The email is thestory@kgw.com, or you can use the hashtag #TheStoryKGW. Here's one we've started to get a lot of recently. Linda wrote, "It's very important to address the drug meth problem in our city before we pay for housing." We also got this one recently from Francis. "No one talks about the real issue, meth, and how easy and cheap it is to obtain." And from Veronica, "My real concern is when we are going to talk about the meth problem." Well, Veronica, Francis, Linda, all the rest of you, now is when we're going to talk about the meth problem, because it is a big problem and it's quickly growing across the country and right here in Oregon. The Department of Justice just made a huge bust in Portland, taking down 2 trafficking cells that seized, get this, 40 pounds of meth. 40 pounds. And in October, officers made the biggest meth bust in Oregon history. Take a look at this, 384 pounds of meth, worth more than $1 million, somebody's gonna be mad, along with stolen guns and thousands in cash. So yeah, you might say we got a bit of a problem. Now, let's get to an article in The Atlantic that several of you sent to us. It's a long one, but it's worth your time if you haven't read it yet. And by the way, there's no paywall, you can just Google it. It's a deep dive into the changing world of drugs in the United States. It's brought on by the arrival of a new way of making methamphetamine. The author, Sam Quiones, described the way meth production has shifted in the last 15 years. You see, meth used to be primarily made from ephedrine. That's the stuff that's in Sudafed and other cold meds. It's why you and me and nobody else in Oregon can buy them over the counter anymore. You have to go to the pharmacy. Well, those regulations have made it harder to make meth. And then the legalization of marijuana took big money out of the pockets of the cartels. They were not happy. So they started making what officials are now calling P2P meth. They can make it quickly, and as a result, it's spreading across the U.S. According to that article, because the drug market has been flooded with meth, the price has fallen dramatically. And it is awful, by the way. P2P meth severely damages the brains of people who use it, and it creates or makes worse mental health and addiction disorders, which makes some of our most stubborn problems even worse. Things like overburdened mental health facilities and homelessness. The article cites Portland and Central Oregon as places that are seeing problems with this. We wanted to get some stats. The Mental Health Addiction Association of Oregon says meth is now a leading cause of drug-related deaths in Portland. And across the state, overdose deaths have increased dramatically over the last 15 years. In 2010, according to the state medical examiner, 43 people died from meth in Oregon, and that was awful. But 9 years later, in 2019, that number was 289 people. That's in line with the number of people dying from opioid overdoses. We took this topic to Central City Concern. They provide services for people who need help with mental illness, drug addiction, housing, and other issues. They say they also have noticed the increase in meth use, but they say there's a lot going on.
I think that we're seeing an increased level of agitation in general, and I would say it's multifactorial. I think methamphetamine is a part of it. I think trying to survive on the street during a pandemic is part of it. The absence of support and resources kind of in the community that we used to have, that have naturally abated during the pandemic has been a part of it. Difficulty with access to other services. So again, as I said, as you really think about it in the big picture, you feel it. You feel issues around agitation and personal angst and safety on the street. And some of it is perhaps really, is related to methamphetamine, but there's this whole other host of factors in people's experience these days that needs to be taken into account as well.
Things are tough when you got to have a hard hat in your office, by the way. She says there does seem to be ready access to drugs here in Portland and that people are using it for all kinds of reasons in all kinds of places, from social settings to the streets.